Hello, my name is Dr. Char Slezak, and I'm a licensed clinical psychologist and the Director of Child and Adolescent Services at SamaraCare Counseling Center.
And I'm Dr. Friedrich, also a licensed clinical psychologist and Director of Clinical Psychology Training at SamaraCare Counseling.
We would like to take a few minutes to speak to parents and their children and adolescents about addressing the COVID-19 pandemic.
These are strange times that may be especially challenging and confusing for our kids and teenagers. Talking about the COVID-19 pandemic can be a difficult task. Parents might be asking, how do I explain all the sudden changes? Staying at home, not visiting or hugging grandparents, canceled playdates, only socializing through phone or video chats? What am I supposed to do when my child is crying over the loss of normalcy? When my teenager is sad, angry, isolating in his or her room, or resentful about all the missed milestones of their youth, like graduation, prom, their own performances?
These are tough questions to take on. The COVID-19 crisis is unlike anything we have faced in our current generations. There's fear and anxiety, mourning and loss, confusion and sadness. The uncertainties and unknowns are hard to explain to our kids. When so much feels out of control, it is important to bring reassurance and comfort. As parents, prioritize mental health, both for yourselves and for your children. Take care of yourself so that you can be present in the moment, calm and collected. Practice deep breathing to regulate your body. Keep to routines as much as possible, and actively focus on modeling acceptance and compassion for circumstances outside of one's control. Acknowledge your feelings of fear, anger, anxiety, helplessness. As Dr. Dan Siegel, a prominent, well-respected psychiatrist, talks about the need to name our feelings, to tame our feelings. Naming feelings for your children is also helpful. What you model as a parent can have a huge impact on how your child perceives the current crisis. While you might believe that you look calm, kids are perceptive, so care for your mental health. Model coping with the situation, and in turn, help your kids and teens to care for their mental health.
Oftentimes, it is a natural response to turn and run from our emotions when feeling anxious or overwhelmed. By sticking to routines, going to bed and waking up at the same time daily, eating meals together at regular times, incorporating exercise or physical activity daily, taking time out of the day to be in the fresh air, attending virtual Sunday worship services, and distinguishing time throughout the day. Time for work, play, to be together, to have alone time, to reach out to friends and family through technology. This can help you and your family stay present. By providing support through routine for your kids and teens, you are fostering a sense of security and a semblance of normalcy in this time of uncertainty. We also want to stay emotionally available to our children. They see our stress, anxiety, or sadness during this time, so make space for your emotions. Allow your kids to talk about the emotions they see and feel. Let them guide the conversation. Be curious. Find out their experience, their emotional needs. Allow expression of feelings and provide information appropriate for their age level. And also be aware that children may not have the words for how they feel, and so they act out their feelings. Behavior is how they often communicate, and helping them clarify to be able to name their feelings is important. Even teenagers have difficulty naming feelings at times, as it may not be cool to admit that you are scared or angry that your life is so disrupted. Also, be mindful of the news sources your children are exposed to through you or on their own devices. Give them a sense of emotional safety, as well as opportunities for growth. Take family walks, engage in the arts, and spend time in the yard or around the table playing games together.
Some young children may also be confused and perceive this time as vacation. And we need to explain that we need to be careful about germs and stay inside. It is something different, something we've never experienced in such a big way. You can talk about times when someone in the family was once sick and you needed to wash your hands more and keep a distance from that person so you don't get sick. And now we have to do that with the large community, not just family. And for those parents who are working from home and need to rush to be on a conference call or feel stressed about responding to emails or completing a project, it may be easy to become frustrated with your kids when they're distracting. Remember, young children may not share your sense of urgency about these responsibilities. Plan ahead. Let them know you will not be available for a period of time. Then give them options to occupy their time. I have heard of several interesting stories of how children and parents are being imaginative and developing new games. Remember, children even as young as 3 and 4 can be creative, and allowing them to express ideas can be wonderfully surprising. There are many online sources for ideas for parents, including 250,000 museums that you can visit online. The children's museums are also regularly posting ideas for creative ways to keep your kids engaged, as well as your friends, people on Facebook, and other social media.
In times of uncertainty, we can find comfort in our faith traditions to make sense of this. Praying with children and adolescents may give them a sense of doing something to help or contribute, which we know helps us feel better. Look for the ways people come together to support each other. As we slow down, life is different, and we hope you can appreciate this different pace. Remember, even in times of hardship and change, there are still smiles and moments to enjoy and laugh.
And it is important to stay connected to each other by phone, Skype, FaceTime, writing letters to those you may not be able to visit face to face. I recently heard a story from my pastor about a single mom who lost her husband a couple years ago. She has a 3-year-old and a 5-year-old and is working from home. She took her sons on a walk. The 5-year-old had a bike, the 3-year-old had a scooter, Mom took a stroller for when the young one got tired. A mile out, the 5-year-old's bike tire blew. Mom put the 3-year-old in the stroller, the 5-year-old helped push the stroller. Mom carried the bike, the scooter, and half pushed the stroller, and was really frustrated. Her son suddenly looked up and said, "Mom, this is the best time ever." Mom was surprised and asked, "Why?" He responded, "We get to spend more time together, go for hikes, bike rides. It's just the best." Your children may experience this time differently than you. We at SamaraCare are here to help you. You can visit our website, SamaraCareCounseling.org, or call 630-357-2456. Our therapists are offering telehealth to comply with social distancing, and a few therapists are in the office seeing people face-to-face and taking all the precautions we can. This is a time where we are in this all together, and we wish you well. Take care.